Colonoscopy is considered the gold standard when it comes to screening for colon cancer. It helps doctors visualize the entire colon, and they're able to remove polyps they might find during the procedure.
The purpose of doing a colonoscopy is more out of prevention than actually finding the cancer. So if we go in and remove all polyps, we virtually eliminate your risk of colon cancer.
Most colon cancers develop from polyps, so removing them before they could turn into cancer makes sense to gastroenterologist Dr. Earl Robbins. He says people worry about what to expect when preparing to cleanse their bowel before the procedure.
It is probably the most unpleasant part of a colonoscopy is taking these preparations. And there's not a good way around it, but there are more options today than there were 10 years ago.
Dr. Robbins says there are several products on the market patients can choose from drinks to taking pills. It's an important part of making sure the colonoscopy is successful.
And you really want to make sure the colon is clean, because if you don't have a clean colon, you're not going to visualize everything completely. And the importance of this exam is to be able to visualize all parts of the colon completely, so that we can actually determine if there are polyps present.
People having a colonoscopy usually drink clear liquids the day before the procedure and start the bowel preparations the afternoon before. The day of the procedure, patients are made comfortable with conscious sedation. The colonoscopy itself takes about 15 to 30 minutes, and most people don't even realize the test is over when they wake up.
Most people actually come to, and within 15 minutes of completion of the examination.
Most people take it easy the rest of the day, and the recovery period is relatively short.
Most people can go back to work, especially if we haven't done much in the way of removing polyps.
Kentucky is the #1 state when it comes to colon cancer cases, but Dr. Robbins says he thinks that increasing awareness about the disease will help bring the numbers down.
Not only do we have more primary care physicians referring patients in for screening, we have more patients requesting screening colonoscopy without symptoms.
Former Today Show host Katie Couric also increased awareness about colon cancer after her husband died of the disease.
She promoted awareness probably more than any one individual in the U.S.
While colonoscopy can help prevent cancer, Dr. Robbins says it's also an important tool in catching colon cancer early, something that can make the difference between life and death.
90% of colon cancers that are detected early have long-term survival. So if we can actually screen early and detect colon cancers early, outcome is far improved.